Hey guys, coming to you in the new year. First of all, happy new year, happy 2022. May all your wishes and dreams come true. Recently, in the last couple of weeks, I actually lost my mother. My mother had a stroke and passed away subsequently. Um, and kind of one of the reasons for this video, while my mother was in the hospital, one of the things they did as she lie there is they were checking her glucose levels. And they checked my glucose level, my mother's glucose level on this particular day, and it happened to be a 117. Now, my brother was in the room with me, and my brother, he knows, of course, that I do what I do, and asked, how was that? While the nurse was in the room. And I said, well, normally that's not good, but in her state that she was in, I wasn't sure because that's not exactly what I do. Here's the key. The nurse turned to me and said, no, 117 is good anytime. Anytime that 117 is good. So now for that state, I'm not that sure about that, but I know the information that they have sometimes is not quite accurate. So that's really the purpose of this is that time my mother's blood sugar was a 117. So let me give you a little background. And this is for nurses, doctors, anybody who's been trained the way they're trained, and I understand why they would say that, but it's not actually true. So when a blood sugar is 117, it could happen if you just ate something, or if you just had an energy drink or something like that. That certainly could happen. But on a daily basis, if your blood sugar levels average at 117, that's not a good thing. So I want all nursing students, nurses, doctors, whoever to know that that is not a good thing because that is just the way you guys are taught. But that is not actually true. You in the nursing profession or in the medical profession, they diagnose you with diabetes when your blood sugar averages a 125 over 3 days in a row. So you come into an hospital or a doctor's office and your blood sugar is like 125, 127 or whatever. They're going to bring you back the next day. They're going to do it again. And if it's still over that 125 mark, they're going to bring you in for a third day generally. And on the third day, if it's still high, guess what they're going to do? They're going to diagnose you as a diabetic and they're going to put you on medications of some kind. Now, my mom's was 117. That's only a few points from 125. Now, let me tell you this. What's ideal? Where should your blood sugar levels be? Your blood sugar levels should be between an 80 and a 90. That's what's ideal. That's where you want your blood sugar on a day-to-day basis, generally. Again, normally without eating. You want it at an 80 or 90. So if on a routine, your blood sugar levels are 117, you're not fine. So if they send you home and you get your blood sugar levels and you're in your doctor's office and you get your blood sugar level checked and they tell you it's a 115, a 117, a 119, and they tell you you're fine, go home, please go see somebody else. That doctor or nurse is wrong for you because that's not good. That means you're just steps away. I guarantee you, if your blood sugar levels average 117 this year, in 2 years or less, you will be a diabetic, if not sooner, because you're only steps away from 125, where they're going to diagnose you. So your blood sugar levels should be between an 80 and a 90. Every time you go get them checked and it's creeping up to 100, 102, 107, 110, you are one step closer to diabetes. So the job of the medical profession is not to say you're fine. It is to say, now that you're at 117, how do we get it back to optimal? So when you go to your doctors, here's your question. When they tell you what it is and it's up there, you need to ask them, what's optimal? What is the optimal level? And they will definitely tell you 80 to 90. And then your next question is, how do I get there to 80 to 90? Not to tell you that you're fine with a blood sugar level of 117. Okay? And this works with everything. Blood pressure. That's different. 120 is no longer, 120 over 80 is no longer actually the normal. Actually, the new normal is more like 115 over 75. Okay, so now doctors are diagnosing high blood pressure When you're at 120 over 80, they're considering that to be borderline high normal, sort of. So again, this is just a little education here on blood sugar levels. If your blood sugar levels are consistently up, you need to get that checked out. Take care.